Good afternoon, everyone. So today we are going to talk about cultural competence and communication disorders. I am Dr. Matthews, and I will be your facilitator today. So today's topic again is cultural competence and communication disorders, bridging gaps and fostering inclusivity. So our objectives today is to define, identify the advantages and disadvantages of cultural competence, talk about how we can find culturally competent clinicians, as well as how a family can influence and impact their clinician to become more culturally competent. So the first question is, what is cultural competency? In order to address what cultural competency is, we first have to understand what culture is. Culture refers to the shared beliefs, values, customs, traditions, language, arts, social norms, and practices that characterize a particular group of people. It encompasses the way of life and community or society and includes both tangible and intangible elements that are passed down from generation to generation. Culture influences how individuals perceive the world, interact with others, and make sense of their experiences. So knowing what culture is, we can now dive into cultural competency. So to be culturally competent means that you possess the knowledge, skills, attitudes, and behaviors necessary to effectively work with individuals from diverse cultural backgrounds. Cultural competence is an essential Cultural competence is essential in various fields, including healthcare, such as being a speech pathologist, a OT, a doctor, as well as education and social services and beyond. So what does cultural competency look like in the field of speech pathology? Cultural competency involves several key practices and approaches. As a speech pathologist, we need to be our cultural awareness and sensitivity is extremely important. Speech pathologists have to demonstrate awareness of our own cultural biases and the importance of cultural diversity in communication disorders. We must approach our work with sensitivity and respect for other cultural backgrounds, values, and beliefs that are important to our clients and their families. To be culturally competent, a speech pathologist must have a deep understanding of cultural diversity present within the populations that we serve. This includes knowledge of different cultural norms, traditions, customs, communication styles, and linguistic variations relevant to various cultural groups. As an SLP, we use assessments and intervention approaches that are tailored to different individuals' cultural backgrounds and needs. We must consider cultural factors when setting goals, selecting therapy techniques, and designing treatment plans to ensure that they are culturally relevant and effective. A culturally competent SLP also possesses strong communication skills that allows them to interact effectively with people from diverse cultural backgrounds. They are able to listen actively, communicate clearly, and respectfully, and adapt communication styles to match the cultural preferences of others. Culturally competent SLPs value collaboration and partnership with individuals and families from diverse backgrounds. We must engage in collaborative decision-making, seek input from others, and actively involve individuals in the planning and implementation of therapy. We also must continue our cultural awareness and professional development. We have to receive training, or we have to seek training and or experience in working with culturally diverse populations. We may choose to complete workshops or additional academic coursework, any type of professional development activity that focuses us on cultural competence and diversity in speech pathology. Most importantly, we must have a respect for cultural diversity. We must demonstrate that we are committed to addressing cultural barriers to access and participation in therapy. We must advocate for equitable services and strive to create a welcoming and inclusive environment for all of our clients and families. Overall, cultural competency in speech pathology involves understanding and respecting the cultural diversity of clients and their families, adapting services to meet their cultural needs, and promoting effective communication and collaboration across diverse cultural groups. So then that poses the question of, how do you identify a culturally competent clinician or speech pathologist? Identifying whether a speech-language pathologist is culturally competent requires careful observation, communication, and assessment. You want to inquire about the SLP's training and their experience with working with diverse cultural backgrounds. You want to ask specific questions about how the SLP integrates cultural factors into their assessment and intervention. Request examples of past cases or success stories involving clients from similar cultural backgrounds as yours. Assess the speech pathologist's communication style, openness, and willingness to learn about and respect cultural differences. You want to seek feedback from other families or professionals who have worked with that specific SLP. Most importantly, you want to trust your instincts and choose a speech pathologist who demonstrates respect, empathy, and understanding of your family's cultural needs and preferences. By using these strategies, families can determine if an SLP possesses the cultural competence necessary to effectively meet their needs. So, there are advantages and disadvantages to everything. What are the disadvantages of not having a culturally competent speech pathologist? Some disadvantages include misdiagnosis. Without cultural competence, a speech pathologist may misinterpret communication behaviors or patterns that are typical in one's culture, but considered atypical in another, leading to misdiagnosis of communication disorders. An example of this would be the sound D for T in AAVE. Another disadvantage is ineffective interventions. Interventions that do not consider the client's cultural background may be less effective or even harmful. Cultural insensitivity can lead to interventions that are not aligned with the client's values, beliefs, or communication styles. It can cause a lack of engagement. Clients and their families may feel marginalized or misunderstood if the cultural needs are not addressed, leading to a lack of trust and engagement in therapy. In addition, it can cause communication barriers. Cultural differences in communication styles and language may create barriers to effective communication between the speech pathologist and their client, which could hinder the therapeutic process. You can also have a cultural mismatch. That's when a lack of cultural competence can result in a mismatch between the services provided and the cultural needs and preferences of the client and their family, reducing the likelihood of positive outcomes. You also have stigmatization. Clients from culturally diverse backgrounds may experience stigma or discrimination if their cultural practices or beliefs are not understood or valued by their speech pathologist, leading to feelings of shame or alienation. We don't want that. Lastly, you have to recognize that a huge disadvantage is disparities in access to care. Cultural incompetence may contribute to disparities in access to quality care for individuals from marginalized or underserved communities, exacerbating existing health disparities. Overall, the absence of cultural competence in a speech pathologist can lead to a range of negative outcomes, including misdiagnosis, ineffective interventions, lack of engagement, communication barriers, stigma, and disparities in access to care. It underscores the importance of cultural competence in ensuring equitable and effective communication services for all clients and families. So, what are some of the advantages of having a culturally competent speech pathologist? Number one, accurate assessments. Cultural competence enables a speech pathologist to accurately assess communication abilities by understanding and considering cultural differences in communication styles, norms, and behaviors. It also allows the speech pathologist to tailor the intervention. Culturally competent speech pathologists can develop interventions that are tailored to the individual's cultural background, ensuring interventions are meaningful, relevant, and effective. It enhances engagement. Clients and families are more likely to engage in therapy when they feel understood, respected, and valued. Cultural competence fosters trust, rapport, leading to great engagement and therapeutic outcomes. Effective communication. Cultural competence enables a speech pathologist to navigate cultural differences in communication styles and language use, facilitating effective communication between the speech pathologist and their client. It improves outcomes. When you have culturally competent interventions, you are more likely to be successful in achieving therapeutic goals and improving communication skills, leading to better outcomes for clients and their families. Reduce disparities. Culturally competent speech pathologists help reduce disparities in access to care and outcomes by providing equitable services that meet the needs of clients from diverse cultural backgrounds. And it strengthens relationships. Culturally competent speech pathologists build strong, collaborative relationships with clients and their families, promoting a positive therapeutic alliance and facilitating long-term success. And that is exactly what we want. So you may ask yourself, as a patient, a caregiver, or even someone who is a healthcare administrator, how do I find a culturally competent speech pathologist? The first step would be to do some research and look for referrals. Start by researching speech pathologists in your area who specialize in working with culturally diverse populations. You can ask for referrals from your primary care providers, pediatricians, school professionals, other community organizations, and more than likely, a friend or a family member might have some information. Ask these different individuals what their experience was like in working with that speech pathologist. Look into online directories. Explore online directories and databases that list speech pathologists who specialize in cultural and linguistic diversity. Websites such as the American Speech Language Hearing Association, also called ASHA, and professional directories may provide search filters to help you find a speech pathologist with expertise in cultural competence, and maybe even specifically in your cultural background. Contact professional organizations. Reach out to local or national professional organizations such as ASHA or multicultural SLP organizations for recommendations on resources and finding culturally competent SLPs in your area. Most states have a local speech therapy organization to help you find speech therapists in your area that have expertise in the area you're looking for. Community resources. Check with community centers, cultural organizations, or advocacy groups serving diverse populations. They may have information or referrals for speech pathologists who are culturally competent and have experience working with specific cultural communities. Always ask questions. When contacting potential speech pathologists, do not hesitate to ask questions about their experience, training, and approach to cultural competence. Inquire about their experience working with clients from diverse cultural backgrounds and how they integrated cultural factors into their practice. Request the consultation. Consider scheduling a consultation or initial meeting with a speech pathologist to discuss your family needs, concerns, and cultural background. This allows you to assess whether the SLP demonstrates cultural competence and is a good fit for your family. Seek feedback. Ask for feedback from other families or individuals who have worked with the SLP in the past, especially those from a similar culture. Their experiences can provide valuable insight into that SLP's cultural competence and effectiveness. Lastly, trust your instincts. Choose a speech pathologist who makes you feel comfortable, respected, and understood. Cultural competence goes beyond qualifications and credentials. It involves building a trusting and collaborative relationship with your SLP. By taking these steps, you can increase the chances of finding a culturally competent speech pathologist who can provide effective and culturally responsive services for you and your loved ones who may have a communication disorder. Something else you may ask yourself is, I met this speech pathologist. They don't have a lot of experience with diverse populations, but I really like them and I want to work with them. So how can I help them become more culturally competent? Well, families and patients play a crucial role in helping clinicians enhance their cultural competence. Some ways that you can support your clinician in becoming more culturally competent is to have open communication. Encourage open and honest communication with your clinician about your family's culture, background, values, and beliefs. Provide insight into your cultural practices and preferences. That will help the clinician better understand your unique needs and tailor intervention accordingly. Share resources. Offer resources such as books, articles, or community organizations that the speech pathologist can reach out to that will help provide them with more information about your culture or your cultural practices that may be relevant to communication disorders. These resources can deepen a clinician's understanding and appreciation for your cultural background. Provide feedback. Offer constructive feedback to your clinician about their cultural competence practices. Let them know what aspects of their approach are culturally sensitive and effective, as well as areas where improvement is needed. Your insight can help guide their professional development and enhance the quality of care provided. Participate in collaborative goal setting. Engage in collaborative goal setting with your clinician. Taking into account your family's cultural values and priorities by actively participating in the goal-setting process, you can ensure that the therapy objectives are culturally relevant and meaningful to your family. Offer cultural insights. Be willing to share cultural insights or perspectives that may influence your communication patterns, family dynamics, or treatment preferences. Your firsthand experience and observations can provide valuable context for the clinician and inform their clinical decision-making. Lastly, provide a supportive environment. Create a supportive environment for your clinician to ask questions, seek clarification, and engage in cultural learning. Cultivate an atmosphere of mutual respect and understanding, where both you and the clinician can feel comfortable discussing cultural differences and exploring cultural competence together. By actively engaging with your clinician and providing valuable cultural insights and resources, you can help them enhance their cultural competence and deliver more effective, culturally responsive care to your family. This collaborative approach fosters positive therapeutic relationships and promotes better outcomes for individuals with communication disorders. So, with all of that being said, I would love to let you know about our next Join the Conversation meeting. It'll be over collaborative support, the synergy between speech pathologists and caregivers in the brain injury rehabilitation. It will take place on March 9th, 2024 at 12 noon, presented by yours truly, myself, Dr. Matthews. I hope you will join us and have a great day. Bye.